So I think this may be basic for some people, but actually, even though I've been trying to learn this for many years, just doing the research for this helped me clarify some of my thoughts, so hopefully that will help. I have a disclaimer that anything I say today has nothing to do with my employer's views. So we're going to talk about efficiency, thoroughness, trade-off, complex adaptive systems, and work as imagined and work as done. And this is for you, Jeffrey. I find this very useful. All models are wrong. Some models are useful. So I think they're just starting points to clarify our thinking, and then we add complexity and nuance. But sometimes it does help to boil things down to at least starting points. Efficiency, thoroughness, trade-off. I credit all of these ideas to Eric. He's not here, but this is his work that I'm representing as best I can. So he talks about an efficiency, thoroughness, trade-off challenge. That to be efficient, you want to minimize resource use, and resources can be all manner of things. They are the time it needs to take to do something, the materials you need, the financial support, the psychological effort, which could also be the work effort, the physical effort, and then staff, any resource that you need that is not infinite. And then thoroughness is the ability to proceed if the necessary and sufficient conditions exist. So you need the necessary conditions, the necessary resources to be in place. I struggle with this. To be thorough, you need to make sure that you have the necessary and sufficient conditions. Then again, these might be time, they may be information, materials, energy, competence or capabilities, and then tools. So there's always this balance between being efficient and being thorough, which is what he's exploring. And as we saw in Robin's presentation, there are pressures to increase efficiency. As individuals, we make a lot of decisions in our brain when we're doing something that it's good enough. So we want to get this done. We want it to be correct. But at this point, maybe it's good enough. Sometimes we say this usually works. So we're doing a process, and maybe we haven't dotted all the I's and crossed all the T's, but this usually works, so it'll be okay. Also, someone else is checking, so maybe before, maybe it's a process that requires a lot of different inputs, and maybe we think somebody else checked it for accuracy or correctness before we got to it, or maybe somebody else is going to check it later on. But because somebody else is checking, I can go quicker and be more efficient. And then there's a need to economize my time, my resources, which could be cognitive resources. And that is a genuine need. It's not a bad thing, but it's a need that I only have so much time or so much cognitive capacity, so I need to economize. But he also talks about collective or organizational pressures that, of course, they want to reduce unnecessary costs. We hear frequently, no margin, no mission. We have to have enough money to do the things that we think we need to do. But he says there's an interesting phenomenon with the organizational processes, which is the double bind of them saying explicitly, safety is our #1 priority, but you know implicitly that cost containment is actually the priority, or there may be it may be reputation. I mean, there may be other things, but there's this difference between what the organization says and what the organization actually wants. But what he says about organizations is they have the ability to split these competing demands between different groups or different people or different work units, whereas as an individual we don't. Of course, that takes that is the perspective closer to the front line or the coalface, because as you get up higher in the organization, then again, the decision for the organization as a whole is the same dilemma as a decision for individuals. So he also, I think he had a lot of fun with this when he wrote this. He talks about a thoroughness-efficiency trade-off. Thoroughness addresses the potential for unexpected occurrences in the future. So you're making sure you have covered all the bases, you have, put everything in place that you're going to need for whatever might happen in the future, predictable or unpredictable. And here's his point about balancing thoroughness and efficiency. So he calls this the efficiency-thoroughness trade-off. I think it's a conundrum. People have to be both efficient and thorough at the same time. Now he says, or rather to be thorough when with hindsight it was wrong to be efficient. So the way I've interpreted that is that you have to have been thorough in the past when in hindsight you should have been efficient. Again, it's a conundrum which we see all the time. We have trade-offs in documentation. You could spend hours and hours documenting a patient's history. I didn't say this earlier, but my background is as a surgeon. I'm a pediatric otolaryngologist, ear, nose, and throat surgeon for kids. So how much do you document about an individual patient in preparation for what? For some review at M&M or some audit or some pressure to optimize your billing. So how much time do you spend documenting versus just getting the information you need, taking care of this patient, and moving on, because there's more patients waiting for you to be seen. And I think we have the same thing in data collection when you're doing research. I can't tell you how many times I've collected a bunch of information and then looked back and wondered why I didn't ask like a couple more questions that would have helped shape my interpretation better. So again, in healthcare, these are very classic trade-offs between thoroughness and efficiency. So I think that's ETTO. I don't know if anybody has a question at the moment or if I should go to the end. Keep going. Oh, sorry. And this is Eric's diagram, which is, again, about this conundrum that you have to be efficient in the present. To be efficient in the present, you must have been thorough in the past. And then to be efficient in the future, you have to be thorough in the present. Because you can't be efficient unless you have laid the groundwork from a thorough process. So I think that's a very cool diagram. And he has, all this stuff is online. And I'm happy to share the slides also, as Robin was. Okay, complex adaptive systems. Here I have borrowed from many, many learned people, so many that I can't even give credit to all of them, but complex adaptive systems, I think, is a really fundamental concept in understanding resilience engineering. So I have 3 slides, so I just numbered them 1, 2, 3. One is the characteristics. Complex systems include agents, and we are all agents. All the people in the system are agents. Some people get offended by that term, but it's an engineering term. But I like it because I think it's whoever. It's the healthcare providers. It's the support personnel. It's the administrative leadership. I mean, it's everybody. So we are agents, each of whom acts, and those acts impact all the other agents, and vice versa. And this is a very dynamic process. And each of us as an agent responds locally to available information, to the opportunities we perceive, and to the constraints that we perceive. And we respond based on our own internalized rules, our understanding, and therefore control over the system is dispersed and decentralized. And I have an example of what I think is sort of a complex adaptive system, and this is driving in India. So that's all models are wrong. Some models are useful. That is somewhat of a complex adaptive system. Other characteristics, interactions are nonlinear, and what that means is that it's not like a one-to-one response. Like you may do something or somebody may do something and the response may actually multiply or the response might actually fade away. No single component, no single individual can completely understand the entire whole system. And you can't completely understand the system just by breaking it down into parts. And you may be able to understand individual parts, and some individual parts may actually be very linear and very broken or not broken, but when you put them all together, they create a whole that emerges that is more than the sum of the parts. And system boundaries are fuzzy and difficult to define, and that is one of the distinctions from other, engineering mechanistic systems. And that's why I think why Carl says, or Robin, you look at the goal in deciding, but otherwise systems are just infinitely expandable because they're impacted by so many things in the environment. Systems are not in equilibrium. They're adaptive and their behavior changes over time. And again, we heard threads of this in Robin's presentation. So that means that you may come up with the perfect solution for a circumstance as it was last week, but it may be different this week. And once you implement your improvement in a system, the system itself responds to that improvement and it is no longer the same. So that's adaptation and, constant adaptation and responses. Function is not bimodal. Again, there may be components that are either working or broken, but many times we try to accomplish a task and we have partial success. And so you can't always break things into it worked or it didn't work. With patients, we may improve their condition but not fix it. That's the nature of the beast. Complexity arises because there is such an intricate web of relationships and interactions that from which the complexity arises or emerges. And this is one of my favorites. Unpredictability and paradox are ever present, and some things will remain unknowable. And I do believe that you can understand some of the principles, and some of the principles underlying these processes may conflict with other principles that are also true, and there are paradoxes, and they are not always resolvable, but they're interesting and they're worth exploring, but I don't know you can always resolve them. And finally, work as imagined and work as done, another really basic set of concepts that Eric articulated. Here's a variation of it from a Texas Bix Bender, which is there's rules to ride in a horse, but the horse won't necessarily know them. So Eric's work spoke to work as imagined versus work as done, and this is about how the work as imagined is maybe the work of regulators or the work of the RCA people. Or, it's the sort of the 30,000-foot conceptual view of how work happens. It's also the view of people who want to control work or regulate work or establish standards for work. This is how work should be done. And then there's work as actually done, which is what really happens. We've learned the term at the coalface by the frontline workers, people who actually do the work. There's always some reason it's not exactly as imagined, although, as Carl said, there's a continuum between those things that can be standardized and those things that can't or shouldn't be standardized. But the work as done always, to be successful, frequently requires some sort of adaptation. So I thought about that and I thought, well, there's a bunch of views of work, and I see these all as different lenses to look at work, none of which is wrong, all of which have limitations. And so it's understanding the lens that you're using and what that lets you see and what that doesn't let you see. That's important. So work as document is, particularly in the US, is incredibly important. because it's if you didn't if it's not documented, it wasn't done is sort of the mantra. People have to, if you're taking care of a patient, describe everything that you did for the patient. And that can be impacted by how hard it is to document, because we have electronic health record systems that can be very cumbersome. And also, if you saw all your patients in the day and got way behind and said, I'm going to go home and write the notes tonight at my house at 11 o'clock at night, you may not remember all the details or have it be as completely thorough as you would have wished. But work as document is used for like trigger tools when people search records to say, oh, here's they used this drug, that's a rescue drug, that's an alert that some sort of bad thing happened. So work as document is the source of those sorts of analyses. Work as abstracted, I used to say this was like big data, like aggregating large data sets and looking for faint patterns that didn't necessarily show up anecdotally in my clinic in the small number of patients that I see in relative terms. But when you look at huge data sets, you might see that, oh, this drug really does have an advantage over that drug on a population basis. I think also this is the basis of the machine learning or the artificial intelligence comes out of work as abstracted. But it often takes generalizing, so the nuance, the details in particular cases sometimes gets lost when big data is put together. There's work as claimed. This is also a big thing in the US. This is the medical malpractice. Institutions pay a lot of attention to malpractice claims because of their financial value or the financial cost to the institution. But typically they are a very selected, skewed piece of work that was done, and they take years to come to a conclusion. And so as a learning resource, they're very limited and not timely and skewed, because the lawyers will only take cases that are worth a lot of money. They're not going to bother with small things. Work as observed. This is a couple of things. One is that when you watch work, just being there, you have the Hawthorne effect, which means that just being observed impacts what you do. This could happen with like leadership walk-arounds. When the leaders come around to see how work is done, it's not always done the same way as when they're not there. And also, work as observed to me is different observers see different things. So if you bring a sociologist or a human factors engineer to watch what you're doing, they'll see different things, which is valuable. But if you also bring another surgeon or another anesthesiologist or another nurse, they also see things that the human factors or the sociologist person may not understand. And so you need all those perspectives. And then work as simulated, that's one of my favorites, because I think work as simulated approaches work as done. It doesn't get there. But if you take real teams, real equipment, and simulate in real patient care spaces, you can identify processes that work and processes that don't work. So these are just all different perspectives. Again, I think of them as lenses. They each give you some information to approach work as done. Each has limitations and each has attributes. And that's my presentation.